My name is Michael Jones. Everybody calls me Mike. I live in New Milford, Pennsylvania.
My dad is 77 years old. He's always been very active. He's had a few health issues over the last couple of years, but generally very healthy. So in January, when he started to have some symptoms, it was unusual.
We thought he was having a stroke, so we called the ambulance and rushed him to the hospital.
It took a while for the diagnosis to actually come through. So it wasn't until about 11 o'clock at night when we got the word that it was not a stroke, it was actually his aortic aneurysm that they had been monitoring for a couple of years was actually starting to rupture.
First thing that they said that I needed to have an operation. And first thing I told them is no blood.
His last words that I heard was, if he doesn't take a blood transfusion, he's gonna die.
Sharon called me the night they were heading up into Binghamton to the hospital and said, Mike is really sick and he may not make it. Can you come up to the hospital? And I looked outside and it was the worst ice storm. I mean, there was no road. It was a sheet of ice. As a family friend of the Joneses, I also read up on different things that can be done instead of blood transfusions. And I mentioned those things to the doctor as maybe alternatives. He's willing to take these. Would you be able to use that? And they just simply said, you're not a doctor. You don't know what you're talking about. He's going to die if he doesn't take a blood transfusion.
We weren't finding anyone locally that would agree to do the surgery without blood. And we were starting to feel that we didn't have a lot of options here.
In the meantime, I had a call into Englewood Hospital, and I got a call back from a coordinator there, and she took all the information down like all the other hospitals did, and then called me back and said, we'll take him.
Dr. Klein called me and started to explain that he was willing to do the surgery. Then it became a question of how are we going to get him down there, and how fast can we get this to happen?
And it ended up that they helicoptered my husband to Englewood for emergency surgery.
He suffered what's considered a life-threatening cardiovascular emergency that we call a type A aortic dissection, where a part of the aorta, the main artery that comes out of the heart and gives blood supply to the rest of your body, develops a tear, a sudden tear.
We got to the hospital, it must have been 3 or 4 hours later, and the first words I heard from a brother was, "Don't worry, Mike's okay." And that was a relief.
He had a rather uncomplicated, beautiful post-operative course without any major issues and was discharged in a timely fashion.
He seemed like he was doing pretty good, up and walking and eating good, and yeah, things seemed like we were on the upside.
In March, he started to have some pain in his jaw.
We ended up calling an ambulance, and of course it was snowing, and we went to another local hospital in Binghamton, New York.
They did the CT scan. What they wanted us to have done was a catheterization. And we weren't comfortable with anything that was even mildly invasive. And again, we had no guarantees that if anything went wrong, that they would not do any procedure without blood.
And I got a phone call from my husband, and he says, the choices are either that we allow them to do the catheterization or I'm discharged. And he says, just leave me here to die. And I said, no way. So I got on the phone and I called Englewood. And they said an ambulance will be on the way.
His chest pain indeed proved to be due to a small size heart attack. I performed an angiogram, and what I was actually there to demonstrate was what was the status of his own or native coronary arteries. And they were incredibly severely blocked. So severely blocked that you wonder how he got through the previous surgery. Another testimony to the care that he received.
They did the catheterization and determined, started putting stents in him. It was 3 different procedures, 7 stents.
They're a lifesaver. They were very kind and considerate, and they didn't try to push you in one way or another. They just says, we can do it, no problem.
There is no fighting, no bickering, no long, hard discussions with the doctors or the nurses or the staff. They know where we stand, and they're very willing to cooperate and follow our wishes, and we really appreciate that.
I would definitely recommend Englewood Hospital. They treat the whole person. They genuinely care about you, and we could not have gotten better treatment anywhere. From the person in the cafeteria who asked how he was doing every day, to the doctors and the staff and the nurses, everyone. They are really special.
Well, if I had to do it over again, I'd go right back. I've got a friend there. The hospital is my friend.